Hello, Turquoise Mama here. I wanted to talk about blood pressure and blood pressure medicine today. For those who would like information on these two subjects, I wanted to let everyone know I was on the blood pressure medicine amlodipine, AMLODIPINE. I'll of course put that in the title of the video probably. And when I first put me on it, I was only on 10 milligrams, and I started having swelling in my feet and ankles really bad. So I called my doctor's office, and they reduced the dosage to 5 milligrams. So I started using that. That seemed to work fine with the swelling. And then I stopped having as much issues with the swelling. Well, back in February, this past February, I had to change my schedule, and so I got off my medicine taking schedule, and was just because I was off my schedule, got off taking the medicine, and was taking it whenever I remembered, and then I went like 4 or 5 days without taking it at all because I had totally forgotten to take it, and then I was like, oh crap. So I just said, you know what, I'm just going to go back to my regular schedule when I was taking it before, and I did that, and the swelling in my feet and ankles just blew up. So I was trying to manage that and try to do stuff, take aspirin and put my feet up, and I've been trying to cut down on my sodium for many years now, or several years, trying to deal with that and change diet and stuff like that. But things just weren't working. I couldn't get the swelling to go down, so I did make an appointment with my doctor, and I stopped taking, prior to that, I did stop taking the allodipine, whatever it's called, however you pronounce it. And so prior to the doctor's office, I did that. So I got to the doctor's office and let him know what was going on. And my doctor put me on this other medicine. I'll, of course, also have that in the title. I'm trying to find my other glasses because I can't read it with these ones. It's annoying that I have to change glasses for this type of stuff. This to read, I have to use these ones. Losartan is what I'm on now, and I just wanted to discuss how that's going because right now it's not going too well, but in one sense, I mean, the swelling's gone down, but I'm having a lot of this side effects. But I've only been on it a week, so I'm hoping that goes away. Hopefully, I have a follow up with my doctor in July. She wanted me to come back in 2 months to discuss that. Also, they wanted to do some blood work, so sorry, I'm getting distracted. Trying to bring up this list of side effects so I can list, because it's a big list, and I am so right now having I'm had several of the side effects of that. Okay, now it's not bringing me to the page that I was. Side effects. Let me see. Okay, so on the list that I'm doing, or on the list that they have, this is the ones I'm experiencing. Now, I haven't had the bird vision per se. Now, I had stopped. I had gone to the eye doctor some years back because of my eyesight, and that doctor, she told me, well, you're over 40, So some of your issues is just because you're over 40 and your eyes are just going to get worse. You need reading glasses, is what she said. But she did also tell me that I have allergies, and she prescribed just getting some allergy medicine drops, where you just get the drops put in your eyes. So I hadn't been using those for a long time. So I went out and bought a new bottle of that to start putting that in my eyes so that I could distinguish between blurry vision from it's due to allergies or if it's due to this new medicine. So far, my blurred vision actually been better because I've been putting those allergy drops in my eyes. I'm not sure if I'm having confusion, but because I don't feel well. I think it's just because I don't feel well. It's not necessarily that, but I'm trying to monitor that issue. I'm not feeling nausea, but I do have the stomach pain. I do have a stomach ache, and that seems to be causing pain in my left shoulder and up into my left side of my head. Now, I just took some ibuprofen probably about 30 minutes ago to see if that would help, and I'm feeling better already because I woke up this morning. I just got up about half an hour ago, and the stomach pain, and that shoulder and the side of my head was hurting, and I didn't want to deal with it. Obviously, who wants to? So I took some ibuprofen, even though ibuprofen is supposed to be harsh on the stomach, but I was like, I'm going to see how it goes. So I took four pills, which are 80 milligrams a piece, I think, on that bottle. I'd have to check. I don't want to get up and look. Let's see, what else do I have? Now I have had, and see down here it says headache, so I've had that. Muscle pain or cramps, my body has felt. I've just felt sore all over. It's kind of like when you're getting sick, you just feel. I did have some tightness in my chest last night when I went to bed, but I don't feel that right now. It says decreased urine output. I'm having the opposite. Yesterday I was going to the bathroom like a lot. I was like, oh my gosh, okay, seriously. And she had my doctor wanted to put me on this other medicine, and she listed one of the side effects was it'll make you urinate more because you're trying to flush out all the stuff that would cause swelling. And I'm like, no, I don't want that one because I already have issues of having to go to the bathroom, and sometimes I don't get a lot of warning. I guess it, comes with part of its age too, being over 50. So I was like, no, I don't want that one. And of course, this medicine seems to be having that issue. So I'm like, great. Okay. But, fortunately, I don't work outside the home, so I'm at home, so I can at least run to the bathroom anytime. And I don't have anybody over my shoulder. Why are you in the bathroom? You've been in there a long time, or you go to the bathroom awful lot, It's like, yeah, I do. And that's one reason why I probably can't work outside the home, because I'd probably get in a fight with these people. It's like, I'm over 50, deal with it. I'm saying? I don't think I could. I'm not looking forward to going back to the work world anytime soon. And my husband's needing me, fortunately, right now with his health issues. So he's needing me here at the house, so it works out. And that's my excuse. But I'm too old to play these stupid crap games with the work environment. And I don't have the patience, and I don't have the self-control. That's why I had to quit my last job, is because it's gotten so bad. I was so stressed out that I couldn't keep my mouth shut, and I had become a person I didn't want to be, and I was like, okay, I can't do this anymore. Something's got to give. So I quit a 5.5 job, and I've been at home ever since. And then right after that, COVID hit, so we were all stuck to our houses anyway. And then all that stuff. So, anyway, let's see what else. I'm not seeing it here. I don't know why this list is different. I thought I was at the same Mayo Clinic site. But the other day I was seeing that one of the side effects was constipation, but I've had the opposite. So, I thought it was something I'd eaten because the other day I had some pork and there was a lot of fat in it, and a couple years ago had my gallbladder taken out, and they said that would cause, if you're eating fatty foods, it could cause diarrhea or loose bowels. And so I had eaten that. We had made a pork roast, and I had grabbed some, and it was a really pretty good size of fat in it, but I ate it anyway because it tasted good. And then ever since then I had some issue with loose bowels, so I thought it was that. But after a couple of days it was still happening. I was like, okay, wait a minute, and I was wondering if this medicine is having that effect on me. To be honest, today I've had one bowel movement, and that one wasn't as loose. So, maybe my body's adjusting. Of course, I've had some other fatty foods, like dessert type stuff. So, I don't know. We'll see. Just letting people know exactly kind of what's going on with me for those who are interested and are dealing with issues. We got to be honest about this stuff, right? To another honest part that's saying you could have decreased sexual desires, and on that line, I don't know. I can't judge that necessarily because of my husband's and I's health. We really aren't really participating in that, especially his, because it just causes too much pain in general to participate in that activity. So can't really say. I'm not going to be able to say if that's really affecting us or not, because we've kind of had to put that aside in our marriage. To be honest with you. So, I might have some lack of appetite. I've kind of not been feeling as hungry as often, so that might be a side effect that I'm experiencing. But anyway, I just wanted to share some of these with you. Anybody needing to hear this. I do hear my husband coming in. He ran to the store to get a couple items, so I hear him coming back. So I'm gonna want to end this video, but I did want to also let you know, if those interested, I am gonna be getting a computer setup soon, and be able to switch all this and hopefully have a better setup of making videos. And my son again is going to be moving out, so I'm going to be moving to a different room so I can have another more setup, and hopefully it'd be something nicer than this what I have behind me, and kind of make a nice little setup there. And I do plan on doing some gaming, so I'll be old lady great gamer. So I'm looking forward to that. So that should be happening in the next few weeks. But I hadn't been able to make a video because I've had a lot of stuff to do and didn't have time and just to set up. And then now I'm been on this medicine. I haven't felt well, so I was like, definitely don't feel like making a video. But I grabbed the opportunity. My husband stepped out, so it was kind of quiet in the house. So I was like, oh, good, maybe I'll make a quick video and kind of let people know what's happening for those 5 people who are my subscribers. So, but anyway, that's it. I will get back with people. I still have my list of things I want to talk about and discuss, and that's still sitting there in my little notebook. And when I get my setup, my new setup, I'll be able to make videos better and more often probably, and everything will be so much better. And hopefully better sound and hopefully better camera quality. Okay, so again, thanks for watching, and I'll keep you posted on this information. And if anybody has any questions, just leave it in the comment, and we'll catch you next time. Thank you.